Welcome to this series of videos about curriculum development in health profession education. And the main aim of this series is to support postgraduate health profession education with the important skills, knowledge for curriculum development, implementation, and curriculum evaluation. My name is Mohamed Hassan Taha. I am medical educationalist aiming at advancing health profession education to enhance the population health through social accountability and equity. Today's video will be about discussing a very important issue related to curriculum development is the curriculum overload. And now with the advancement of the knowledge, change in the healthcare system, expectations of the patient, there is many issues and many topics that faculty, medical teachers want to integrate it or instill it within the curriculum. So this will be our discussion today. So the session is about curriculum overload, core and optional modules, and elective. We are facing challenge in health profession education because we are responding to information overload and building this lead to building the options for building for option and core curriculum. And there is a mismatch between the expansion in the medical knowledge and the curriculum time and the time that we deliver the curriculum, particularly for undergraduate programs. So this necessitates the need of having core curriculum and option curriculum and elective. And the problem with information overload, this has been described in many contexts in health profession education. There is advancement in knowledge in medicine, biomedical science, and curriculum committees, they actually struggle to think about what to add these topics or to remove this topic or to give more time to this. And there is a new and important area, compete the curriculum space. For example, now there is a call for teamwork, interprofessional education, professionalism, patient management, end-of-life care, health education, personalized medicine. And there is a very strong rationale behind introducing this topic into the curriculum because it's needed. But at the same time, there is a constraint with the time limit. So a fundamental principle is often ignored with this time limit if we try to integrate everything. And medical educators cannot continue to back more into the curriculum. And this will create a more challenge. So this is a rationale behind having core and elective course. Also, there is a changing role in for medical teachers, from information provider to learner facilitators, to guide the learning process, the resource development of the learning capabilities, and prepare students for lifelong learners. If we have curriculum overload, this will be against lifelong learners, and it's very important that this issue that need to be considered, and students need to have sufficient core knowledge to maintain their clinical competence while serving the community. Having this approach, core curriculum and option, this is very important because this approach will help the student to have a structured opportunity to study area of interest in greater depth, this for the core. And at the same time, this will help students to have more achievement through the elective or called student selected component. So we will use this abbreviation in the rest of the presentation. SSC is for student selected component. So every curriculum should include core curriculum and option curriculum or student selective component. And this approach is encouraged area like by some authorities like the Tomorrow Doctors by the GMC. And the core curriculum should not be less than 70% of the curriculum or 90%, while the student selected component will be between 10 to 30% only. So this equal to half to one and half day per week for the electives, or 3 to 9 weeks per the total academic year. So what are the educational advantage of deciding from the beginning this is a core curriculum? Deciding from the beginning this is a core curriculum, it will help learners as well as educators to highlight essential learning for all students. align with the competencies and the outcome, and protect against excessive specialization in the curriculum, and to support equivalence across the institutions, particularly for the transfer between one institution to other. It's also standards for benchmarking, for the assessment, for reference point, for progressions, and assessment without a defined core lack legitimacy of the curriculum. And the educational advantage of elective also, on the other hand, and student-selected components. It allows students to study selected subject in depth, explore area not covered in the core curriculum, clarify career interest. They can progress in their career with this elective, and engage deeply with motivated faculty teaching this elective or student-selected component. And the responsibility for who is responsible for specifying the core and elective. This should be all stakeholders, the clinicians, the basic scientists, the education leaders, and the curriculum committee should take the lead and the accountability for that. And this should not be left to individual disciplines, because every individual discipline, they have enthusiasm toward their specialty. And the criteria to include including in the core curriculum, this should be for the topics that are common in clinical practice, serious or life-threatening, prerequisite for further learning, and they are illustrative for of key principles. It is very important. So we cannot make elective for these topics. Common, life-threatening are prerequisite requisite for further learning, and they include the key principles. While for the student-selected components and elective, we can keep it for the topic that are needed, advanced or core subject, uncovered clinical specialties for the students, non-medical specialty relevant to practice, maybe like art or engineering or AI technology, some advanced AI material, because AI should be integrated as part of the curriculum, including the rational and ethical use of AI. Medical education as a profession also could be elective for those who want to pursue their career in medical education or health professional education. Interprofessional learning and research as advanced skills of doing research and advanced analysis skills. Assessment of elective or student-selected components. Assessment must be transparent, outcome-linked, and integrated with a problematic assessment, and portfolio is the key. A final important question that needs to be asked, and this key question for the educator, is the core curriculum explicit and protected in the curriculum? Are threshold concepts identified at the learning principles of the curriculum? Do electives or student-selected components add educational value or no? Is information overloaded actively managed or no? So curriculum design requires discipline and courage. And it's very important from the beginning to decide what is core and what is optional in the curriculum. Thank you so much for watching this video, and looking forward to see you in the next series of video, which will be related basically to special format and approach in designing the curriculum, including, and the next video will be about clinical presentation curriculum.